Hello, this is Dr. Denny, and one thing I want to share with you now is I want to share with you some stretches. What I call these is brushing and flossing your spine. Now, I come from a long line of dentists. I have 7 dentists in my family, and so one thing I was always told growing up, I was told that you always need to keep brushing and flossing your teeth to keep them healthy, right? To keep them from degenerating, keep them from having cavities. Now, one thing I want to share with you, movement is excellent for helping prevent cavities or arthritis or degeneration, subluxations in your spine. So one thing that I'll do from now on, from today for the rest of my life, is I'll keep stretching my spine. I'll keep brushing and flossing my teeth. I'll keep getting my teeth checked by my dentist. I'll keep stretching my spine. I'll keep getting my spine checked by my chiropractor. Now, I want to show you these simple exercises. A lot of people, when they do stretches, they do it for their legs, their hamstrings, their quads, their arms, upper body, but a lot of times they don't take their spine through a full range of motion. So what I want to show you is a very simple exercise, very simple stretch. If you're doing yoga can take the place of this. Yoga is basically full range of motion stretching, plus it's got amazing meditation type practices in it. But this is for those days where you're in a rush and you don't have a lot going on, you have a lot going on, and you just can't get in to do your yoga classes. So what I'm going to do is I'm going to take you through a full range of motion. Now I'm going to do it fairly quickly, but what I'd recommend for you is if any of these hurt, I want you to stop. You just let us know. That just means you're not ready to be able to do that stretch right now. Once we get your spine adjusted, get it moving better, you'll be able to do the stretch down the road. But with this stretch, when I go as far as I can go to one side, I'll actually hold it there for 10, 15, or 20 seconds, and then I'll go to the other side, hold it there for 10, 15, 20 seconds, depending on how much time I have. And the whole time I'm doing that, I'm taking deep breath in. Do not hold your breath during this. Take deep breath in, let it out. Deep breath in, let it out. But for today's purpose, for this video, I'm just going to go through it real quickly so you can see all the different ranges of motion. First thing is you want to take your spine through rotation. I'm going to do this with my neck and with my low back. So my feet are pointing straight towards the camera here. I'm going to turn my neck as far as I can turn, and then I'm going to take the rest of my spine with it. So I turn, and I go all the way around. I'm going to do the same thing. Now again, when I get all the way around is what's comfortable to me. I'm going to get to that point and I'm going to hold that position for 10 to 20 seconds. And then what I'm going to do is I'm going to go to the other side. Again, holding that for 10 to 20 seconds. The next thing is the side bend. It's a lateral bend from one side to the other. So what I do with this is I always start with my neck, go off, I bring my arm up, and then I'll lean all the way over to the side as far as I can, holding this for about 10 to 20 seconds. And then, of course, I love this stretch. Going to the other side, all the way over. Deep breathing while you're doing it. Good. Now the next one, so what we're doing so far is turn to the right, turn to the left, lean to the right, lean to the left. Now we need to lean forward and backwards. Now with leaning backwards, I usually go through the range of motion. I don't hold it for 10 to 20 seconds. If you're comfortable doing that, great. If not, this is also a time where you might want to have something around just to hold on to for support. So what I do is I'll look up and back, and I'll come back up just like that. And the last thing is going down. Now, bending down, I break it into 2 parts. I break it in the neck and then the lower back. So going down, I'll actually lock my fingers just like this, and I'll put it right behind my head and pull down on my neck. Now here's a little trick for you. A lot of times people get right at the base of the skull, they get a lot of tension there, and that can cause a lot of headaches. So when you're bringing your head down like this, tilt your head to one side and then tilt it to the other side. You're going to feel it hit the muscles right here and right there, which is actually going to help relieve a lot of headaches for you. After I do that stretch, I'll then bend forward as far as I can to touch my toes. Now, don't be discouraged if your range of motion or your flexibility isn't very good. The more you do this, the more you get in the habit of doing this, the better off you're going to get, and you're going to get better and better as you go along. Also, the other thing is again, don't get discouraged about your range of motion, but you'll get better and better, and your flexibility will get better and better. But this is going to help prevent a lot of degeneration, help slow down the degeneration process. Movement is an amazing healer. If you think about people nowadays, as soon as they go to the hospital to get like a shoulder surgery or a knee surgery or even open heart surgery, Used to, they were put on bed rest. They were put on bed rest for weeks. They found out that was the worst thing for them. In fact, actually, movement is an amazing healer. So it's going to protect your spine for the rest of your life. So again, just like a lot of these things I'm teaching you, this stretch is something that you want to do for the rest of your life because it's going to help prevent you. Nowadays, when people have surgery, they're immediately put in some type of machine where they're moving their knee back and forth, or they're put in doing physical therapy in the arm, or even major open heart surgery. They're out walking the hallway the very next day. So again, movement is an amazing healer. If any of these hurt, let your chiropractor know that, and then we'll work with getting that better, getting that area of the inflammation and the tissue damage down. That way you can do this and do this the rest of your life. Have a great day, and we'll see you again soon.